like a GSW. I'm cutting.
Okay, applying the seal.
Hi, I'm Cynthia and I'm a firefighter paramedic.
How you doing? I'm Sean and I'm a tactical paramedic.
Today, we're focusing on the Seal Pro version of our hemostatic wound spray. This is designed for moderate to severe bleeding and intended for trained providers and responders.
When hemorrhage is the problem, it's rarely a single point bleed. It's surface area, it's irregular geometry, it's multiple vascular injuries across tissue. You may not be able to compress evenly. Seal Pro is built for this challenge. Rapid coverage, uniform application, fast bleeding control.
Seal Pro is composed of chitosan, a polysaccharide, basically a natural sugar. Chitosan works through electrostatic interaction. The positively charged glucosamine units bind to negatively charged red blood cells. This enhances platelet adhesion and accelerates blood coagulation at the vascular injury site.
Seal's chemistry is fine-tuned. It uses chitosan with increased glucosamine availability. Those groups are converted, which enhances electrostatic interaction with blood. In short, we supercharge the electrical attraction. The average particle size is approximately 100 microns, increasing surface area and improving hemostatic efficiency.
Seal Pro delivers that chemistry through an 80 psi aerosol system. That pressure allows product to reach irregular surfaces and recessed wound geometry. The propellant exits cold and evaporates instantly. That brief temperature drop may aid vasoconstriction, further assisting hemorrhage control. Operationally, this is the system: shake, spray, coverage, pressure. Seal Pro 2.5 ounces is indicated for control of severe topical bleeding in emergency situations. Think traumatic amputations, deep lacerations, penetrating trauma such as gunshot or stab wounds, avulsions, degloving injuries, basically situations where speed and surface coverage matter.
Seal Pro does not replace hemorrhage control fundamentals. It supports them. It can be used with direct pressure, pressure dressings, wound packing, hemostatic gauze, and tourniquets. In fact, it makes them more effective.
There are several considerations when using Seal. Do not use on injuries involving the eyes. Protect the eyes with your hand when treating head and neck wounds.
Seal is not recommended for sucking chest wounds or open skull fractures.
Remember to maintain a distance of 6 to 10 inches during application to reduce blowback and maintain control. We always say you should train using the spray actions of Seal before an emergency.
Lastly, Seal Pro is a single patient use device. It may be used on multiple wounds on that same patient. However, to ensure you always have sufficient product to deal with bleeding, discard and move to another can after a single patient.
Now let's go over the steps to deploy Seal. First, don appropriate PPE. Remove the can from the box, your kits, or MOLLE pouch. Hold the can firmly, shake the can until you hear clicking.
The click indicates it's ready. Remove the cap and look for the arrow showing the direction of the spray.
Expose and fully access the wound. Cut away clothing and confirm the bleeding surface. If the wound is narrow or collapses inward, apply slight lateral traction to open the wound for deeper penetration. If blood is pooling, wipe just enough to allow interface contact. You are not cleaning, you are clearing the surface.
Position the can 6 to 10 inches from the wound. Start slightly further away and move closer while spraying to control depth and minimize backspray. Depress the nozzle. Cover the entire wound surface. Sweep as needed. Adjust the distance to match the wound size and geometry. Seal Pro can deliver 2.5 ounces in approximately 5 seconds. Bleeding typically stops or drops significantly within seconds. Commit the full can if necessary. Use additional cans for larger surface area injuries if required.
Apply a sterile dressing and hold firm pressure for 3 minutes. Pressure consolidates the matrix into a stable barrier. Secure with a pressure bandage if available. Let's put those steps into practice. Here we have an upper leg GSW. PPE on. Remove Seal Pro from the box. Shake until clicking. Cap off and expose the wound.
Holding the can approximately 6 to 10 inches away, depress the nozzle. Begin slightly further out and move closer while spraying to ensure penetration into recesses and edges. Allow the product to build within the wound bed. It conforms to the injury. Bleeding reduces rapidly.
Apply sterile dressing. Firm, steady pressure for 3 minutes.
Reassess. Bleeding is controlled. If needed, integrate with other interventions such as packing and a tourniquet.
At Definitive Care, remove dressings. Irrigate with sterile saline or water. Gently wipe away unbound product. Light debridement if needed. Treat the wound per standard medical practice. Remember, Seal only binds to blood, not water or moisture. Make this process simpler.
Thanks for training with us today. Remember, hemorrhage control with Seal is a system. Shake, spray, coverage, pressure.
Shake until it clicks. 6 to 10 inches. Smaller wound closer, larger wound further away. Full surface coverage. Get as much product into the wound. Firm pressure, then transport. Seal the bleed, save a life.